Shipman's MO was terrifyingly simple, and that was precisely why it worked. He targeted the elderly, mostly women who lived alone. They were patients who trusted him completely, people who saw him not as a threat, but as a reassuring constant in their final years. To them, Dr. Harold Shipman wasn't just a physician. He was a familiar face, a calm voice, a man who made house calls when others wouldn't. He would arrive for what appeared to be a routine checkup, no rush, no suspicion. He'd sit by the bedside and chat about the weather, ask about their children, comment on how tidy the house looked. All the while, he was preparing a syringe filled with diamorphine, an amount far beyond anything therapeutic, a lethal dose. The injection was quick, almost casual. Within minutes, the patient would be dead. Narrator. But here is the part that kept him safe for 27 years: the paperwork. As a doctor, Shipman had authority that few people ever questioned. He could sign death certificates, and so he did over and over again. He wrote causes that sounded natural, inevitable, unremarkable. Old age, heart failure, phrases so common they barely registered. Then came the final, calculated suggestion. He would gently advise grieving families that cremation was best. It was simpler, he'd say more dignified, less distressing. And with that single choice, the evidence vanished forever. If a family member hesitated, if someone said, "But doctor, she was fine an hour ago," Shipman never faltered. He would look them straight in the eye, his expression calm, sympathetic, practiced. He'd lower his voice and say, "Her heart just gave out. It was peaceful, she didn't suffer." And that was enough, because who doubts a doctor? Who questions the man who signed the certificate, offered comfort, and spoke with such quiet certainty? For decades, no one did.